Hello everyone, I'm Dr. Sarah Mitchell, and if you're watching this video, chances are you or someone you love has received concerning news about elevated PSA levels. Before we dive deep into today's crucial topic, I need you to do 3 things right now. Hit that subscribe button, ring the notification bell, and drop a comment telling me what brought you here today. Your engagement helps this life-saving information reach more men who desperately need it. Now, let me ask you something that might shock you. What if I told you that some of the vitamins sitting in your medicine cabinet right now could be secretly driving your PSA levels through the roof? What if the very supplements you're taking to stay healthy are actually working against your prostate? In my 15 years as a urologist, I've seen this scenario play out hundreds of times. A patient comes to me panicked about their rising PSA numbers, and when we dig deeper, we discover they've been unknowingly sabotaging their prostate health with the wrong vitamins. The worst part? Most doctors never think to ask about supplements. Today, I'm going to expose the 5 most dangerous vitamins that can artificially inflate your PSA levels and potentially mask or complicate real prostate issues. But more importantly, I'll share exactly what you should be taking instead. The science-backed alternatives that actually support optimal prostate function. This isn't just another generic health video. This is potentially life-changing information that could save you from unnecessary biopsies, reduce your anxiety about prostate cancer, and put you on the right path to genuine prostate wellness. So grab a pen, take notes, and let's dive in. But first, let's quickly review what PSA actually means and why these numbers matter so much. PSA stands for prostate-specific antigen. It's a protein produced exclusively by your prostate gland. Think of it as your prostate's signature in your bloodstream. Normal PSA levels typically range from 0 to 4 nanograms per milliliter. But here's what most men don't understand. PSA isn't just about cancer. Your PSA can rise due to inflammation, infection, benign enlargement, recent sexual activity, exercise, and yes, certain vitamins and supplements. This is why I always tell my patients. An elevated PSA is like a smoke alarm. It tells you something needs attention, but it doesn't tell you if it's burnt toast or a house fire. Here's a startling fact. Studies show that up to 75% of men with elevated PSA levels don't have cancer. Yet many are taking supplements that could be contributing to unnecessary elevation and anxiety. This is exactly why understanding the vitamin PSA connection is so crucial. Now let me reveal the 5 vitamins that could be sabotaging your PSA levels, starting with the most surprising one. Vitamin number 1 that's secretly driving up your PSA, iron supplements. This one shocks most of my patients because iron seems so innocent, right? Wrong. Here's what happens. Excess iron creates oxidative stress in your prostate tissue. Think of it like rust forming inside your prostate. This oxidative damage triggers inflammation, and inflamed prostate tissue produces more PSA. It's that simple, yet that devastating. I had a 58-year-old patient, let's call him Robert, whose PSA jumped from 2.1 to 6.8 in just 6 months. He was terrified of cancer. When we investigated, we discovered he'd been taking a high-dose iron supplement for energy. Within 3 months of stopping the iron and addressing the oxidative stress, his PSA dropped back to 2.3. Research published in the Journal of Urology shows that men with elevated iron stores have PSA levels that are, on average, 40% higher than men with normal iron levels. The study followed over 1,200 men for 5 years, and the correlation was undeniable. How do you know if iron is your problem? Look for these signs: metallic taste in your mouth, unusual fatigue after taking supplements, darkened stools, or joint pain. If you're taking iron and experiencing elevated PSA, this could be your smoking gun. The solution? Get your ferritin levels checked immediately. If they're elevated, work with your doctor to safely reduce iron intake and consider natural iron chelators like green tea extract and milk thistle. Vitamin number 2 will surprise you even more. Calcium supplements, especially when taken in high doses or without proper cofactors. Here's the hidden danger. Excessive calcium, particularly calcium carbonate, can disrupt your body's delicate mineral balance. When calcium levels spike without adequate magnesium and vitamin K2, it creates what we call calcium chaos in your prostate tissue. Imagine your prostate as a finely tuned orchestra. Calcium is like having too many drums. It drowns out the other instruments and creates discord. This mineral imbalance triggers inflammatory pathways that directly stimulate PSA production. The Harvard Health Professionals follow-up study, which tracked over 47,000 men for 18 years, found that men consuming more than 2,000 milliliters of calcium daily had a 32% higher risk of advanced prostate cancer and consistently elevated PSA levels. I treated a 62-year-old engineer whose wife insisted he take calcium for his bones. His PSA rose from 1.8 to 5.2 over 8 months. Blood work revealed severely depleted magnesium levels and calcium-magnesium ratio completely out of balance. We corrected this with proper mineral balancing, and his PSA normalized within 4 months. Warning signs of calcium excess include kidney stones, constipation, muscle cramps, irregular heartbeat, and yes, rising PSA levels. If you're taking calcium supplements and experiencing these symptoms, you need to reassess immediately. Instead of isolated calcium, focus on bone-building nutrients in proper ratios: magnesium, vitamin D3, vitamin K2, and trace minerals. Your prostate and your bones will thank you. Vitamin number 3 is perhaps the most controversial: vitamin E, specifically synthetic alpha-tocopherol. This one breaks my heart because vitamin E was once hailed as the ultimate prostate protector. But here's what the research really shows. Synthetic vitamin E can actually increase prostate cancer risk by 17% and significantly elevate PSA levels in certain men. The problem lies in the form. Most vitamin E supplements contain only alpha-tocopherol, which can actually deplete other crucial forms of vitamin E in your body, particularly gamma-tocopherol, the form that's actually protective for your prostate. The SELECT trial, involving over 35,000 men, was stopped early when researchers discovered that men taking 400 IU of synthetic vitamin E daily had higher rates of prostate cancer. But here's what they didn't tell you. The men taking gamma-tocopherol showed protective effects. Synthetic alpha-tocopherol acts like a bully in your cellular environment. It pushes out the beneficial gamma-tocopherol, disrupts antioxidant balance, and can actually promote oxidative stress in prostate tissue, the exact opposite of what you want. How do you know if vitamin E is affecting your PSA? Check your supplement labels. If you see DL-alpha-tocopherol or just vitamin E without specifying mixed tocopherols, you're taking the problematic form. The smart approach? Switch to mixed tocopherols with emphasis on gamma-tocopherol, or better yet, get your vitamin E from whole food sources like sunflower seeds, almonds, and spinach. Vitamin number 4 might surprise you: folic acid, the synthetic form of folate found in most multivitamins and fortified foods. First, let me be clear. Natural folate from leafy greens is beneficial. The problem is synthetic folic acid, which your body processes completely differently and can accumulate to dangerous levels. Here's what happens. Synthetic folic acid can mask B12 deficiency while simultaneously promoting abnormal cell division in prostate tissue. This cellular chaos triggers inflammatory responses that drive PSA production through the roof. A study published in the Journal of the National Cancer Institute followed men taking folic acid supplements and found a 163% increase in prostate cancer risk among those taking more than 1 mg daily. Their PSA levels were consistently elevated throughout the study period. I remember treating a health-conscious 55-year-old who was taking a high-potency B-complex with 800 mcg of folic acid daily. His PSA climbed steadily from 2.0 to 4.9 over 18 months. When we switched him to methylfolate and addressed his B12 status, his PSA dropped to 2.2 within 6 months. Signs of folic acid excess include sleep disturbances, mood changes, digestive issues, and paradoxically, symptoms that look like folate deficiency. Many men don't realize their healthy multivitamin is working against them. Instead of synthetic folic acid, choose methylfolate or folinic acid, the active forms your body can actually use safely. Better yet, focus on folate-rich foods like dark leafy greens, asparagus, and legumes. The fifth and final vitamin that could be sabotaging your PSA: selenium, but only in certain forms and doses. This one is tricky because selenium can be both protective and harmful, depending on your baseline levels, the form you're taking, and your genetic makeup. It's like walking a tightrope with your prostate health. Selenium works as an antioxidant, but here's the catch. If you already have adequate selenium levels and you supplement with more, it becomes pro-oxidant, creating the very oxidative stress it's supposed to prevent. This oxidative damage inflames prostate tissue and drives up PSA. The same SELECT trial that exposed vitamin E problems also revealed that men with high baseline selenium levels who took additional selenium supplements had a 91% increased risk of high-grade prostate cancer and persistently elevated PSA levels. Not all selenium is created equal. Sodium selenite, the cheap form found in most supplements, is more likely to cause problems than selenomethionine or selenium yeast. The form determines how your body processes and utilizes this crucial mineral. Before taking any selenium supplement, get your baseline selenium levels tested. Optimal range is 120-150 ng/ml. If you're already in this range, additional supplementation could push you into the danger zone. The safest approach? Get selenium from food sources like Brazil nuts. Just 2 to 3 nuts provide optimal daily selenium, wild-caught fish, and pasture-raised eggs. These provide selenium in perfect balance with other nutrients. Now that we've exposed the 5 vitamin villains, let me share what you should be taking instead. The science-backed nutrients that actually support healthy PSA levels and optimal prostate function. First up, lycopene, the red pigment found in tomatoes. Studies show men with higher lycopene levels have PSA levels that are, on average, 18% lower than men with low lycopene. The key is getting it from cooked tomato products, not synthetic supplements. Second, zinc, but in proper balance with copper. Your prostate contains more zinc than any other organ, and deficiency directly correlates with elevated PSA. Aim for 15 to 20 milliliters of zinc with 1 milliliters of copper to maintain proper mineral ratios. Third, vitamin D3 with K2. Men with optimal vitamin D levels, 50-70 ng/ml, have significantly lower PSA levels and better prostate health outcomes. But always pair D3 with K2 to ensure proper calcium metabolism. Fourth, high-quality omega-3 fatty acids, specifically EPA and DHA, from wild-caught fish or algae. These powerful anti-inflammatories directly reduce prostate inflammation and help normalize PSA production. Fifth, saw palmetto extract, but only standardized extracts with 85-95% fatty acids and sterols. This herb specifically supports healthy prostate size and function, often leading to PSA normalization. Sixth, curcumin with piperine for absorption. This golden spice is one of nature's most powerful anti-inflammatories and has been shown to support healthy PSA levels in multiple studies. The magic happens when these nutrients work together synergistically. This isn't about taking more supplements. It's about taking the right ones in proper combinations and forms. Let me share some real success stories from my practice that demonstrate the power of getting this right. Michael, 59, came to me with a PSA of 7.2 and was scheduled for a biopsy. We discovered he was taking high-dose iron, calcium carbonate, and synthetic vitamin E. We eliminated these, optimized his nutrition with the nutrients I just mentioned, and addressed his stress levels. 6 months later, his PSA was 3.1, and he avoided the biopsy entirely. David, 64, had been battling rising PSA for 2 years, going from 3.8 to 6.1. His urologist wanted to start him on medication. We found he was taking a multivitamin loaded with folic acid and iron, plus separate calcium supplements. We cleaned up his supplement regimen and focused on whole food nutrition. His PSA stabilized at 3.9 within 4 months. James, 52, was terrified because his PSA jumped from 2.1 to 5.8 in just 8 months. Turns out he'd started taking a men's health supplement containing all 5 problematic vitamins I mentioned today. We simplified his approach, focused on targeted nutrition, and his PSA returned to 2.3 within 5 months. The common thread in all these success stories? We stopped the supplements that were working against their prostate health and started supporting their body's natural healing mechanisms with the right nutrients in the right forms. These aren't miracle cures. They're examples of what happens when we remove obstacles and provide proper support. Your body wants to heal. Sometimes we just need to get out of its way. All right, let's create your action plan. Here's exactly what you need to do starting today. Step 1, supplement audit. Go to your medicine cabinet right now and check every vitamin and supplement for the 5 problematic ingredients we discussed. Iron, calcium carbonate, synthetic vitamin E, DL-alpha tocopherol, folic acid, and selenium, especially if you're already taking it. Step 2, get tested. Ask your doctor for a comprehensive metabolic panel including ferritin, vitamin D, B12, folate, and selenium levels. You can't optimize what you don't measure. Step 3, gradual elimination. Don't stop everything at once. Work with your healthcare provider to gradually eliminate problematic supplements while monitoring your PSA levels. Step 4, smart substitution. Replace the harmful supplements with the beneficial nutrients we discussed, but do it systematically. Start with 1 or 2 and assess your response before adding more. Step 5. Monitor and adjust. Track your PSA levels every 3-4 months initially, then every 6 months once they stabilize. Keep a supplement and symptom journal to identify what works for your unique biochemistry. Now, I know this can feel overwhelming, which is why I've personally vetted a comprehensive prostate support formula that contains all the right nutrients in the right forms and ratios. You can find the link in the first comment and in the description below. Remember, this information is educational and should never replace professional medical advice. Always work with your healthcare provider, especially if you're currently dealing with elevated PSA levels or prostate concerns. We've covered a lot of ground today, and I hope this information empowers you to take control of your prostate health intelligently. The 5 vitamins we discussed, iron, calcium, synthetic vitamin E, folic acid, and selenium, could be secretly sabotaging your PSA levels and creating unnecessary anxiety. But now you know what to avoid and, more importantly, what to embrace. Lycopene, balanced zinc, vitamin D3 with K2, omega-3s, saw palmetto, and curcumin. These nutrients work with your body's natural healing mechanisms, not against them. Here's what I need you to do right now. Subscribe to this channel if you haven't already. Hit that notification bell so you never miss crucial health information, and comment below telling me which of these 5 vitamins you're currently taking. Your comment could help other men realize they're making the same mistake. Also, share this video with any man in your life who's dealing with prostate concerns. Knowledge is power, and together we can help more men avoid unnecessary anxiety and take control of their prostate health. Don't forget to check the link in the first comment and description for my personally recommended prostate support formula. I've spent months researching and vetting this product to ensure it contains only the beneficial nutrients we discussed today. Remember, elevated PSA doesn't have to mean panic. With the right knowledge and approach, you can support your prostate health naturally and confidently. Until next time, this is Dr. Sarah Mitchell reminding you to stay informed, stay proactive, and take control of your health. Thank you for watching, and I'll see you in the next video.